Good morning, everybody. Hello and welcome. My name is Debbie Ryan. I'm Chief Executive of Impact Group, and I'm delighted to be able to bring to you today an interview with Stephen Marsden. Stephen is the Executive Chairman of Keyholder Funding. Good morning, Stephen.
Good morning, Debbie. Very nice to be here.
Fantastic. So why don't you tell us a little bit about who you are and what Keyholder does?
Well, yes, thank you. I'm Stephen Marsden. I'm the Executive Chairman of Keyholder Funding Limited, and we're based in Liverpool in the Royal Liver Building. And our company is the world agent for a company called Keyholder Investments Limited, which is operated out of the Isle of Man. What Keyholder has put together is a portfolio of cancer projects that we feel have great potential and will make a big difference to people's lives and offer a great return to people who want to invest. This we call the Cancer Breakthrough Portfolio.
Fantastic. So what is it you're actually looking for in a project then?
Well, to get to the current two that are on offer, we've analysed and interrogated well over 60. So we have a very strict set of criteria. Firstly, the technology has to be completely revolutionary. It has to be completely new, not just an improvement on something that's already there. Okay. And it has to be disruptive, so it can't be ignored by big pharma. But most important, it has to work. So we analyze all the data. It has to have had trials already. If it's a diagnostic, we have access to all the data and possibly results with former commercialization. And we need to see a management team in place that is strong and capable of delivering. The patents form the asset value, and we are particularly interested in that because our investors have a first call on that asset value. And so the patents have to be long life, they have to be easily defended, and they have to be kept up to date.
Fantastic. Even with all of them sort of checks and balances in place, isn't investing in new treatments and diagnostics still high risk?
Well, it can be, Debbie. If you're looking to invest in a new project in the early stage, you should consider that more of a charity than an investment. And at that early stage, when people have the ideas and they don't yet have proof of efficacy, then clinical research organizations or charities, universities, hospitals, friends of the family, this way, business angels, this is where the funding will come from, but it won't come from our investors. Then there's a medium stage, and here we're looking at various degrees of proof, and you can cherry pick in this area. Okay. As they get towards the commercial stage, where big pharma is interested, because in the commercial stage, it already will be proven in certain cancers, but you need to spread to a wider range, and it's a balance sheet item. So it's an asset on the balance sheet. What Keyholder does, it provides an investment that transitions from mid to commercial.
Okay, so what are you actually working on at the moment? What projects are you raising investment for?
The two that are currently available are called Vaxicure and Diatech. Now, Vaxicure is in the field of immune therapy. It's a different type of immune therapy from the norm in that we are looking not to attack the cancer cells with this, but to remove something that is essential for the cancer cells to grow. And so we've got what we call a polyclonal antibody stimulator. It stimulates.
Bit of a long word, that one.
You have to rehearse that a few times if you're going to talk to people. But the PAS, as we call it, it removes an agent called free gastrin. That's a prenatal hormone that causes growth in the unborn fetus. In a full-grown adult, it doesn't have any serious use, but it's essential to cancers in the colorectal tract and in the pancreas. And a cancer cell is a mutation of a normal cell, but it has to find an alternative way of growing, an alternative way of having an agent of proliferation. And it very often will use gastrin. If you take the gastrin away, it has no impact on the patient, but it's devastating to the cancer. It will stop tumours forming. It will stop the growth dead. Now, that is the only thing that's effective at the moment for pancreatic cancer. And more excitingly even than that is that we now find that in combination with checkpoint inhibitors such as Keytruda from Merck, it can improve the effectiveness of the checkpoint inhibitor from 30 to 40% to 80 to 90%. This is revolutionary. And then Diatec, it's not a treatment, it's a diagnostic. It's a platform of what we call assays or tests. And I don't know if you've ever heard people saying that somebody's not responded to chemo, and you think, well, why? Have they been given something that doesn't work? Well, the answer is that all cancer cells are mutations, so they tend to be different. Two people with lung cancer can have completely different types of cancer cells that will respond differently to different treatments. So Diatec can tell you in advance from a biopsy which treatment will be most effective for an individual patient, not only for chemotherapy, but for immune therapy and for PARP treatments, which are the new wave. And that is a game changer. So now people can avoid being treated with medicines and immune therapies that don't have an impact. We know in advance.
I've actually interviewed Robert Henry previously, so we do have that interview available if any of our audience are interested. And what are the funds that you're raising going to be used for then?
Well, for Vaxicure, we already have phase 3 trials for a small batch of the PAS. So the funds are needed now for large-scale manufacture. Large-scale manufacture uses certain synthetic substitutes, so that you need to rerun some of the phase 3 trials to show the large-scale works the same as the small-scale. And also, we want to embark upon some combination trials with Big Pharma. So that's a very clear program for the next 6 to 12 months.
So how long is it before the general public are going to see the benefits of the work that you're doing?
Well, in Vaxicure, we're looking at 1 to 2 years. And with Diatec, we're funding some trials because we want to see this as not an advisory, but a compulsory way of prescribing to stop expensive treatments being wrongly prescribed. And that needs to have FDA approval rather as if it were a treatment. What we're saying is that we have to prove that when we know what works, we get a better outcome than when we don't know. So that's quite easy. But that funding will be required, and it's about 18 months to 2 years we expect to see that reach commercialization.
Fantastic. That's really not a long time at all in the grand scheme of things.
No, it's because we're at this late stage, yes.
Absolutely. Well, Stephen, thank you very much. That's been great to talk to you this morning. If you would like to hear more about Keyholder and Vaxicure and Diatec, well then please get in touch. All my contact details will be available at the end of this video. It just leaves me the task to say thank you once again and goodbye everyone.
Goodbye.